Welcome to Shape Up, where we provide with the latest information and tips to help you achieve your health and fitness goals. So, join us on this journey towards optimal health and fitness, and let's make our health a top priority together. Today, our topic is about ketogenic and low-carb diet. Keto and low-carb diets have become popular in recent years as a way to lose weight and improve overall health. While they share some similarities, there are also some significant differences between the two. Ketogenic diet. The ketogenic diet, or keto for short, is a high-fat, low-carb diet that involves drastically reducing carbohydrate intake and replacing it with fat. The aim of the diet is to get your body into a state of ketosis, where it starts burning fat for fuel instead of glucose. A common ketogenic diet consists of 70 to 75% fat, 20 to 25% protein, and 5 to 10% carbohydrates. This means that you will need to severely limit your intake of carbohydrates, including sugar, grains, and starchy vegetables. Instead, you will need to replace them with foods that are high in healthy fats, such as avocados, nuts, seeds, and oils. Benefits of the ketogenic diet. Weight loss. The ketogenic diet has been shown to be effective for weight loss. Because the diet is low in carbohydrates, it can help you feel full for longer periods, which can lead to a reduction in calorie intake. Reduced inflammation. The ketogenic diet has also been shown to reduce inflammation in the body, which can help reduce the risk of chronic diseases such as heart disease, diabetes, and certain types of cancer. Improved mental clarity. Some people report feeling more mentally clear and alert on the ketogenic diet. This may be due to the fact that ketones, which are produced during ketosis, can provide a more stable source of energy for the brain. Low-carb diet. A low-carb diet is a diet that restricts carbohydrates, typically to between 20 and 100 grams per day. Unlike the ketogenic diet, a low-carb diet does not require you to enter a state of ketosis. Instead, the aim is to reduce your intake of carbohydrates to a level that is sustainable and allows you to maintain a healthy weight. A typical low-carb diet consists of 45 to 65% fat, 20 to 35% protein, and 10 to 35% carbohydrates. This means that you will need to limit your intake of carbohydrate-rich foods, such as bread, pasta, rice, and sugary snacks. Benefits of the low-carb diet. Weight loss. Like the ketogenic diet, the low-carb diet can be effective for weight loss. By reducing your intake of carbohydrates, you may be able to reduce your overall calorie intake and achieve a calorie deficit. Reduced blood sugar levels. A low-carb diet can help regulate blood sugar levels, which can be beneficial for people with diabetes or prediabetes. Improved heart health. The low-carb diet has been shown to improve heart health by reducing levels of triglycerides, a type of fat in the blood that can contribute to heart disease. Differences between the ketogenic and low-carb diets. Keto and low-carb diets have become popular in recent years as a way to lose weight and improve overall health. While they share some similarities, there are also some significant differences between the two. The main difference between a ketogenic diet and a low-carb diet is the level of carbohydrate restriction. While the ketogenic diet requires you to severely limit your intake of carbohydrates, a low-carb diet allows for a slightly higher level of carbohydrate intake. Another difference between the two diets is the level of fat intake. The ketogenic diet is a high-fat diet, with fat making up 70 to 75% of total calorie intake. In contrast, a low-carb diet typically consists of 45 to 65% fat. The keto diet is also more restrictive than a low-carb diet, as it requires you to avoid many carbohydrate-rich foods, including fruit, bread, pasta, and rice. In conclusion, both the ketogenic diet and low-carb diet can be effective for weight loss and improving overall health. However, the ketogenic diet is more restrictive and requires a higher level of fat intake to achieve ketosis. The low-carb diet, on the other hand, is less restrictive and may be easier for some people to follow long-term. It's important to note that both diets require careful planning to ensure that you are getting all the nutrients your body needs. It's recommended that you work with a registered dietitian or healthcare professional to develop a meal plan that meets your individual needs and goals. It's also worth noting that the ketogenic diet is not recommended for everyone. People with certain medical conditions, such as pancreatitis or liver disease, should avoid the diet. Additionally, the diet may not be suitable for athletes or people who engage in high-intensity exercise, as the body may not have enough carbohydrates for fuel. Overall, the ketogenic diet and low-carb diet can be effective for weight loss and improving overall health. However, it's important to choose a diet that is sustainable and something that suits your individual needs and goals. Working with a dietitian or healthcare professional can help ensure that you are following a healthy and balanced diet that meets your nutritional and health needs. Thanks for watching. Please like and subscribe.